Great, thank you so much, and thank you all for spending your Friday with me. I appreciate that. We'll go ahead and jump right in and get started. Just a little bit of an introduction about myself. As Jerry said, my name is Donna Dorzinski. I've been in the industry now for 29 years. I spent the first 15 years of my career in big pharma, working in an organization in early development where we worked from both a sponsor and a site's perspective. I spent the last 14 years with just-in-time GCP, and I work with small, mid-sized pharma companies, really in CRO, small pharma sites, and working with them to help them stay compliant with regulations and a really big focus on trial master file. I am a member of the TMF reference model working group, and I led the Zone 4 revisions with version 3 of the reference model, and I serve on several working groups for the reference model. So just a bit about our learning objectives. We'll talk about regulatory expectations regarding TMF and eTMF management. We certainly have a large set of expectations now that we know are true for both EMA, MHRA, and a little bit with FDA. We will talk about some recent regulatory findings that are directed at TMF and TMF management. And we'll talk about strategies for how you can prepare an effective CAPA that addresses any regulatory findings. And then we'll talk about how you actually plan for a potential inspection. So just to start with the definition of the TMF, it is definitely a standalone set of documentation. And what that means is the content of the TMF should really not require a whole lot of additional explanation. The information should be able to stand by itself. It's the story of what happened with your study. So if it's a good story, it's a good information in there. If it's a bad story, you'll want that bad information in there. But the thing about the TMF is if it's a bad story, you're going to have the bad information, but hopefully you'll also have all of the specific things that you did to remediate any potential issues. So thinking of your TMF as a story is a really nice way when you start to think about, oh, should this particular content be there, or how do I handle this particular situation, whether it's TMF content or not. If it contributes to the story of the study, then it's part of the TMF content. It's the collection of the documentation that allows the inspector or any individual to assess the conduct of the trial, the integrity of the data, and compliance of the trial with GCP. And so really, the TMF is the focal point of the inspection. It's that collective output from all of your functional groups, not just clinical operations, but all functional groups for study-related activities. So what's an essential document? Because people use that term pretty freely. Oh, I'm just looking at essential documents. So essential documents are those documents that by themselves and then all together, as a story, permit the evaluation of the conduct of the trial, the quality of the data. These documents serve to demonstrate compliance of the investigator, sponsor, and monitor with standard GCP and all applicable regulatory requirements. We know that the purpose of a regulatory inspection is to ensure data integrity, to ensure compliance with the protocol in GCP, and to ensure human subject protection. All three of those elements are critical to a health authority inspection. So integrated Addendum ICH E6, a great reference tool, really strong focus on risk, but also finally took a bit of a focus on TMF. And so what they say is that the sponsor and investigator or institution should maintain a record of the location of their respective essential documents. So where do you keep the content? Because we know that TMF content can be maintained in various locations. So where is that particular content being held during the study? So yes, you often have an eTMF, which is fine, but then you have that content beyond what's held in the eTMF. And where is that content, and is that secured in a computer? So that's an important piece here of knowing where this content is. It says wherever you store it, it doesn't really matter. You need to be able to find it and retrieve it in a timely manner. And so that's really if it's paper or electronic. If it's a paper TMF, you still need to be able to find it fairly quickly. And then this last statement here, it says depending on the activities, individual trial may require additional documents not specifically mentioned in the essential document list. So in ICH E6, they give you a list of documents in section 8.3 that is what we call, quote, the essential documents. But what we know, if you go back to my definition of a TMF, it's the whole story. It's not just the story as it's presented in section 8.3, but it's anything that contributes to understanding the story of the study.